Okay, hi everyone, welcome back. Hope you had a good break. Just to let you know, we are recording Nisha's session right now, but at 4:15, we will stop the recording and then Nancy will speak, and we will not be recording Nancy's talk today. So having said that, very happy to hand over to Nisha. Thank you.
Okay, hello everyone. My name is Naoise Standing. I'm a clinical outreach librarian at Kingston and Richmond NHS Foundation Trust, and I'm going to be talking to you today about the dissertation that I did last year as part of my master's degree in Library and Information Studies at UCL. So my session is titled, How Can Community-Based Initiatives Improve Health Literacy Levels in a Deprived London Borough? So before I get started on talking about the research project itself, I wanted to give you a little bit of background about what health literacy is, because if you're not familiar with health librarianship or the health literacy context itself, you might not have ever come across that terminology before. So I thought it would be good just to give you a bit of background knowledge before I talk to you about the research itself. So there are a few different definitions since the term health literacy was coined in 1970, and the NHS has taken the most recent one developed by the US Centre for Disease Control during the COVID-19 pandemic as its current health literacy definition. And this comes in two parts, so both personal and organisational contexts. So personal health literacy is defined as a person being able to find, understand, and use information and services to inform health-related decisions and actions for yourself and others. So that is putting the person at the centre of the health literacy and the person at the centre of their health decisions. So it's about them feeling empowered to be able to make good decisions for themselves that keep themselves healthier for longer and also their family. The other definition is organisational health literacy. And so when we're talking about organisations, we're talking about the context for the UK as the NHS. So this definition means that organisations are enabling people to find, understand and use information and services to inform health-related decisions and actions for themselves and others. So you can see those definitions are very, very similar. And in both of them, they are still putting the person or the patient at the centre of the context. But the organisational one is about making sure that the NHS in this context is doing as much as possible to empower people to find good health information for themselves to look after themselves. So I'm going to give you a few statistics now just to show you kind of what that looks like on a broader level that isn't just the definitions. So first of all, I'm going to give you some information about literacy levels in England. And we're going to be focusing on England because my project looked at a London borough. So in England, it's estimated that roughly 7.1 million adults read and write at the level expected of an 11-year-old. And that number increases when numbers are included. So to give you a bit of an idea, if you're thinking about headlines that you see that are written in UK newspapers, those are usually written for the reading age of 9 to 11 years old. Now, if we put this into a health literacy context, 43% of all adults in England struggle to understand health information that is just words. And much like with literacy statistics in general, that number increases. So it goes up to 61% when numbers are included. Now, when we're talking about adults in this context, we're talking about people aged between 16 and 65 years old. So that half of adults in England are struggling to understand health information, which we'll talk about a little bit later on, but has really, really wide and broad consequences in a lot of different aspects and regions. So you can see I've got a QR code on the screen for you. And I'm going to suggest that you can have a little access of that. You can either do it now or you can access the slides after the session is finished, just so you can get a bit of an idea of the tool that I'm going to talk about now. And this is something called the Health Literacy Geodata tool. So the Health Literacy Geodata tool inspired a lot of the reason why I wanted to do research into health literacy. And it was created a few years ago by Health Education England before it was taken by NHS England and in collaboration with the University of Southampton. It uses the most recent national survey of numeracy and literacy in the UK alongside population data to estimate the prevalence of low health literacy in all English local authorities. So that's the local council areas. So unfortunately, the most recent national survey of numeracy and literacy in the UK was the 2011 Skills for Life survey. So that information is relatively outdated now because the government haven't run another survey of its kind since. But to try and see if we can change that estimate to something that's a bit more relevant to our context now, it is done in collaboration with the 2021 census and the 2019 Index of Deprivation. So what I would suggest is absolutely scan the tool and see if you can find your local authority, because the results may surprise you. They definitely surprised me when I had a look at my personal and my professional contexts, which I'm going to show you in detail now. So yeah, that QR code is on the screen if you'd like to access it. So I think that picture gives you a little bit of an idea of kind of what we're looking at here. So the geodata tool can either go in graph format or it can go in map format, like the picture that I've shown you here. So it goes from green to amber to red. If it's green, it's a lower level of low health literacy. Amber is somewhat close to the average, and red is higher. And I think you can tell what I'm about to tell you now. Oh. So the average level of low health literacy prevalence in England, and this again is for 16 to 65-year-olds for literacy and numeracy, is 58.3%. I currently live in Tower Hamlets. It's not where I was born and raised, but it's where I'm living. And the prevalence in my borough is 67.61%, which is an awful lot higher than the national average of low health literacy. You can see that little green area in the map just to the left of Tower Hamlets. That is the City of London. Now, the City of London has the lowest level of low health literacy in the entirety of England. That might not surprise you because it's known to be a bit more of an affluent area, but the City of London, their low health literacy prevalence is 42.32%. And I live exactly on that green line. So it just shows you it is a bit of a postcode lottery as to the low health literacy rates throughout England. You may have remembered earlier on, I said that I work for Kingston and Richmond NHS Trust. I'm mainly based at Kingston Hospital, and the prevalence of low health literacy there is 49.38%. So it's still under average, but I still consider that to be quite high because it's still 1 in 2 adults in that area are struggling to find health information. So that's giving you a bit of a visual of what low health literacy can look like in a graph and a map term. But what I want to now consider is what can poor health literacy look like for the individuals that have it. So low health literacy can take many different forms, and the main thing to consider is not to judge a book by its cover. So by looking at someone, you can't estimate how they're going to understand the health information that you're giving them. So low health literacy can look like someone having difficulty understanding medication dosages. So it could mean that they take too much medication, too little, or no medication at all. It can mean that people can miss their hospital appointments because they don't understand the letters that they're receiving, where they're telling them where to go and when. Another example is it means that they might have an inability to look after chronic conditions. So when we're talking about chronic conditions, we're talking about conditions such as asthma, diabetes, and heart conditions, for example. Someone with low health literacy might also have an inability to navigate NHS services and digital health tools. So, for example, the NHS app is a great example of that. Since the COVID-19 pandemic, an awful lot of our health information has gone digital and is online. So if someone lacks the digital literacy skills to be able to access it, they are falling behind through no fault of their own. Next is increased hospital admissions and increased healthcare costs. So if someone is struggling to look after their own health, whether that be because they can't make it to their appointments or they don't know how to look after their health conditions properly, they're more likely to be admitted to hospital. And that increased healthcare cost is adding an awful lot of debt to the NHS budget. So in the financial year of 2023 to 2024, it's estimated that health literacy reasons cost between £5 and £8.5 billion of the NHS budget. That is a phenomenal amount of money when you think about it. So it's something that absolutely we need to look at mitigating health literacy as a reason to why people are struggling to look after their own health. People with lower health literacy are also more likely to be vulnerable to misinformation. And the one thing that we know we can for sure gather from all of this is that those with low health literacy have the worst health outcomes in our society. So, working in healthcare libraries and healthcare institutions, it's absolutely our job to see what we can do to help these people. So, all of that information inspired me to start my own research into health literacy. And my master's dissertation was just a great excuse on being able to do that. So, the first thing I wanted to consider is what health literacy was like in the borough of Newham. Now, you might be wondering where the borough of Newham has come from, because it does seem like a bit of a random one if it's not where I live. But when I was looking at the geodata tool, the London Borough of Newham has the third highest prevalence of low health literacy in the entirety of the UK. And their prevalence is currently at 74.78% of people are struggling to understand health information. So I wanted to consider what it was like, not just on paper, but what it was like actually in the borough itself. Next, I wanted to speak to stakeholders within the local community, the local authority, and the healthcare system to gain a wider insight of its effects. Initially, I did want to speak to people that lived within the community itself, but unfortunately, there were some ethical dilemmas that came up with the fact that they might give me some of their own health information, which obviously I didn't want to access unnecessarily. So I just focused on the stakeholders that were involved in creating community initiatives to improve health literacy. Next, I wanted to understand what those health literacy initiatives were that were in place at the time of doing the research. And then I wanted to consider what barriers are there to health literacy and how can we tackle them. So to give you a bit of context for Newham, Newham is known to be one of the most ethnically diverse areas in the UK. So all of this information here is taken from the 2021 census results. So 54.5% of people 54.5% of people in Newham were born outside of the UK. And 42.2% of that population identified their ethnic group within the Asian, Asian British, or Asian Welsh category. 31.7% of the population of Newham do not identify with any UK national identity. They are currently tied with Hackney as being one of the youngest boroughs in London. So the median age of an individual in Newham is 32 years old. According to the census, 56% of people aged 16 years and over were in full-time employment. So the rest of the percentage were either in part-time employment, education, or no employment at all. And around 70% of individuals in Newham do not have English as a first language. So you may be surprised to hear this, but according to surveys in Newham, there's roughly 140 languages spoken. So it's an incredibly, incredibly diverse place, an absolute melting pot of cultures. So who did I interview? So when I was speaking about it earlier in my aims and objectives, I said that I wanted to interview stakeholders that were playing a part in the local community's health information and just their health overall. So I interviewed a healthcare librarian from the local NHS trust. I interviewed a public librarian from the local authority, a surgeon and a pharmacist that are part of that local NHS trust, and then 2 of the local council workers. Now, my interviews took 45 minutes at a time and I had set questions, but people were able to have an opportunity for further discussion at the end of these interviews. So I was asking them questions like, have you heard of health literacy before? Where do you see health literacy in the work that you're doing now? And what role do you think your job could play in helping health literacy within your local environment? And these interviews brought up an awful lot of questions and they brought up an awful lot of answers as well. And what I wanted to do was to kind of pull the results together and see what barriers there could be to health literacy in the local area. So the barriers that I identified were these 5 that are on the screen now. So English as a second language was absolutely a big barrier. As I said previously, there are roughly 140 different languages that are spoken in Newham, so it's a very, very diverse culture and a diverse population. Deprivation and education were also 2 of the main points that came up. Newham is one of the poorest boroughs in London, and they also have a lower level of education and people coming out of secondary schools with traditional examinations. There were also issues to do with information access and something that I'm calling policy and practice, which I'm going to explain to you on the next slide. So those are the main barriers that I identified to health literacy. So what I found that went in conjunction with these barriers is that, first of all, we're looking at community projects and community initiatives. And what we found was that there were community projects that were occurring, but the efforts in that local area were very disjointed. So, as part of some policy work that the local council were doing, they had put health literacy in as one of the steps that they needed to make the local borough of Newham a healthier place. And they knew that there needed to be projects occurring to help improve health information access, but they weren't aware of the projects that were already in place before they started these discussions. So the local public libraries were involved and the local NHS trusts were already involved, as well as some community hubs. And they were already looking at how to improve people's health information access because members of the community were already coming to these different hubs to ask questions. So the council were doing a great job in that they knew this was something that needed to happen, but they were unaware that this was already happening on their doorstep. Alongside this is thinking about data collection. So when the council were looking at putting some of these policies into place and developing health literacy as something to help improve health in the overall borough, they started to do surveys looking at what health literacy was like in the area. But the data that they collected wasn't detailed enough, so it didn't tell enough of a story as to what the issues were and how to help to improve them. So, for example, one of the council workers that I spoke to had mentioned that in one of the surveys, they found that the Bengali community was struggling to access health information. And that was all they could tell me. They had no other information about what was causing the issues. They had no other information about what kind of information they were accessing and why they were accessing it. So it was really difficult to understand where the problems were coming from and then overall how you would solve those problems. So the next point that I want to talk about is actually one of the community initiatives that was in place that I thought would be very beneficial, not just within that community, but within further boroughs across England. So the public library had started to provide free SIM cards, and they were looking at providing loads of electronic devices to help people access information, not just in the library, but wherever they felt they needed to. Because they were fully aware that not everyone feels comfortable in library spaces and that not everyone feels welcome and invited. So they wanted to give people the opportunity to access information wherever they felt comfortable to do so. And that's something that's really important when it comes to health information, because health information is very personal. And especially quite often, if you're looking to access health information, it's not always for the happiest of reasons. So they wanted people to be able to feel comfortable to access this in their own home or out on the go, wherever they felt that they could do it. So what they were doing is the librarians in the public library were providing training to show people how to access the NHS app, but also how to access health information online. And this is fantastic. But unfortunately, they were not being trained by health librarians or any healthcare professionals in the local area. So it was a great system, but they didn't have the backing that they could have done from health information professionals or from healthcare professionals in general. So again, it's a great example of a community initiative that could be brilliant for helping people, but it just shows that the efforts were slightly disjointed. So next is looking at local public health campaigns. And one of the things that I found during my research is that the local public health campaigns that were being delivered by the council and the NHS Trust were great, but they were not always advertised in the common languages that were spoken in the borough. So as I said, 140 languages is an awful lot of languages to translate information into. But they had tried to translate information from public health campaigns before, and this had not been so successful. So one of the examples that I was given is that both the local council and the NHS Trust wanted to improve the numbers of people that were coming to the bowel cancer screenings in the local area. So what they decided to do is that they found from their data that people from, again, the local Bengali community were not attending their bowel cancer screenings. So they decided that they needed to translate that campaign information into the two Bengali languages, just to make it a bit easier for people to be able to understand what the screening was and how to attend. And unfortunately, they did this translation through Google Translate. And as we know, Google Translate isn't always the most beneficial and the most helpful for translating information correctly. So bowel cancer screening got translated to stomach screening. And I'll let you be the judge of how that went. It wasn't the best. Unfortunately, bowel cancer and stomach are obviously two very different things. So people were coming for these screenings and they weren't actually aware of what they were coming to. So again, the intentions were great, but the outcome that was expecting and could have happened just wasn't there. So the next point kind of comes alongside that. So it's talking about the fact that there was a lot of information seeking behaviour going on in the local borough. Both the public librarians and other community members were talking about the fact that people were coming to them with questions about their health and they didn't know where to go. And this also coincided with the fact that the surgeon and the pharmacist that I spoke to said that a lot of the time people were coming into hospital with illnesses, but they were not necessarily asking for information in the right place. And when they were asking for information, that information was specifically for treatment and not for prevention. So earlier on, I spoke about the fact that low health literacy can have an impact on chronic health conditions because someone might have an inability to look after themselves. And this can be evident in prevention as well. So, for example, if someone was asked to lower their salt intake, salt comes in a lot of different foods and a lot of different varieties of things. You're not necessarily going to know exactly what to pull down and how to do it. And it's the same thing with if someone's told to look after their diabetes better. If you're not giving them that information to be able to help with that treatment, but also with the prevention of that diabetes, overall it's going to cost more money and it's going to mean that more people are coming for more appointments that aren't always going to be necessary and could have been prevented earlier. So the information seeking was there, but not necessarily at the right times, and people didn't necessarily know where to go to get the right information. And then last on this slide, I said earlier about my section that I called policy and practice. And again, this is to do with the policy that the Newham Council were bringing in at the time. So this was actually the second iteration of their policy, which they called 50 Steps to a Healthier Newham. And in this second iteration, it was the first time they'd labelled health literacy as a step to improving healthier living within the borough. And something that came alongside this was the 50 Steps Changemakers programme, which is where they wanted to highlight role models within the community, so say such as those running community initiatives to help promote healthy information access throughout the borough. So I came up with a few recommendations from all of this work. And the first thing is that there's never going to be a one-size-fits-all approach. So it needs to be quite a flexible approach to fit the very diverse population of people that live in that borough. So the first thing was I recommended detailed tracking of health incidents. Now, we spoke earlier about data collection not being the best, and this was also evident in the local NHS trust. So in the NHS, we have something called never events. And now from the research that I'd done, these never events, which are events that should never happen, had never had health literacy put down as a reason for these health incidents happening. And we know that health literacy can come into play with health incidents happening. I mean, for example, we spoke about the issues of medical dosages. We know that's a reason that people can overdose or not take enough medication, but health literacy has never, in the research that we've done, been put down as a detail for this. So this is something that needs to change. The data collection needs to be improved because without improved data collection, we don't know what we're trying to solve. The next thing was to meet the community where they are. So to give a good example of this, the surgeon that I spoke to was talking about the importance of community hubs. And we know that people were looking to seek information out in their community and places that they feel comfortable. So one of the initiatives that they were looking to put in place was actually to bring health hubs and health information hubs into local places of worship. So they've been speaking to local religious leaders such as imams and vicars because Newham has quite a high religious population. And they said that these people already feel that they're comfortable in these environments. So why not try and teach them something where they're already feeling comfortable and are more likely to listen and to take on board what you're telling them, which I thought was a great idea. And it's something that they are looking to pioneer in the future. So it's absolutely getting the community involved and meeting them where they are and where they feel comfortable. My last 2 points in these recommendations kind of go together. So it's utilise your librarians and information professionals and collaboration, collaboration, collaboration. I think as librarians and information professionals, we don't toot our own horns enough. We should be shouting for the rooftops about what we can do. And that is especially true in health libraries. I think sometimes health libraries and health librarians do go unnoticed. And there is so much value that we could add when it comes to health information and health information access. We do a lot of work in helping the staff and supporting staff in our hospitals, but I do believe that there is more that we could do within our scope out in our communities. So getting involved with the public. I know that CILIP have started doing some work on public libraries and health information, but at the time, Newham wasn't part of these pilots. So this is something that I would like to see happen a bit wider. So this brings a lot of challenges and potentials, and I'm conscious of time, so I'm just going to go through these a little bit quickly. So one of the challenges to this work is that with the changing face of the NHS, there are changing priorities. But this is a potential in itself because the NHS is changing from a model of treatment to prevention. And with this change in model, there is absolutely a place for improved health information and communication. We know that money is always a difficulty, but as we've seen, health literacy costs a lot of money to the NHS. So by improving health literacy, we are saving time and money for all of these individuals that can be then put back into other uses. And I believe that increasing community involvement can help to cut the red tape. So it can help to bring in new initiatives by showing that the people that need this help are going to be receptive to it. And that's not to put all of the ownership on the community, but I think it'd be fantastic to have them as stakeholders that are more involved in how to access health information better for their own health and for their friends and their family. So since I finished that research, I've actually transitioned from academic to health libraries. So I initially was a business librarian. Now I'm a health librarian. And since doing that, we've just this week introduced a health literacy teaching program in my trust that I've started delivering. So we are teaching health literacy skills to both clinical and non-clinical staff. So we're talking to them about how to give good verbal communication when talking to their patients. And we're also talking to them about how to improve the written information that they are also providing as well. And this is going to change as well as it goes through the year, as the new health students and foundation year doctors are all going to be trained in spotting low health literacy and teaching techniques on how to support their patients. So we're going to be starting, and hopefully these health literacy skills are going to be spreading far and wide throughout the hospital. And then, as a final bit to continue, I did present my results to the local authority that the research surrounded, and some areas for improvement were identified and currently are being worked upon. So I know that there is a working group that is looking at improving the hospital communication methods at the local NHS trust. So the ways in which the health information is being written and also hospital signage is being changed to match up what the staff are saying. So taking away some of that Latin terminology and using jargon-free information to help people access the services they need. And then personally, I'm hoping to continue this work in some format. It would be fantastic to see where this research could go, because I think this could be so well received throughout other boroughs in London and further afield. So just to finish, this is a quote that I got from one of the people that I spoke to in my interview that was really inspiring to me, and I think could be so beneficial for taking the project wider. So they said, we're probably one of the most diverse places, if not the most diverse in the country. If you can crack a project here, you can do it anywhere. And I truly believe that. So there's a few references. And thank you for listening to my talk.
Thank you so much, Naoise. That was really interesting. And a fun fact about me is I was born in Kingston Hospital. So all connection there. I think we've got time for one question. I'm just going to pick this one out of the chat. So someone's asking, since you started working in NHS libraries, are you aware of any barriers to doing more of this work that you weren't all aware of already?
Not so much that I wasn't aware of already, but absolutely time is a barrier. So getting people to be able to have that time to go and receive the training to help with health literacy skills is so difficult because clinicians are time poor. Well, to be fair, all professionals working in the NHS are time poor. There's so much to do and not enough time to do it. So that's definitely a barrier. But I think the fact that we've got this work now into the postgraduate education system in the hospital means that we're going to be reaching people just as they're starting their careers. So hopefully that means that this health literacy work is going to spread far and wide, and then it's going to go on to wherever else they continue to work afterwards.
Oh, brilliant. Thank you so much. That was so interesting. I'm just going to